Hi, and welcome everybody to our mobile triage units infrastructure for unprecedented times. I'm Ralph Evans. I work here at HHI Corporation, who's developed the innovative mobile triage unit. I work and do the marketing here. I'm joined by our partner, Dr. David Epstein, and David has been instrumental in getting this mobile triage unit down to Miami, Florida, where it is now as part of a project delivery. I wanted to go over a little background of HHI Corporation, what our experience is, and go over how the process came about to develop this project. And then towards the end here, I'll have Dr. Epstein jump in and talk a little bit about the Global Surgical and Medical Support Group and a little bit about where the mobile triage unit is now, the delivery we did down to Miami at the Jackson Hospital or Jackson Health System as far as that goes. We welcome any questions as we go through, and then we'll catch those at the end of the presentation as we go through and talk about this. So our background at HHI Corporation is coming to you from just north of Salt Lake City, Utah, where we have some of the best skiing in the world, as far as I feel, but other people will probably debate me on that. But we're up in Ogden, just north. Our campus, as you see here on the screen, is 54 acres. And we have 100,000 square feet of shop space to do all of our metal steel fabrications and to build the mobile triage unit and some of the other things that we're developing, like portable test labs for COVID-19. We have a 50-year track record of high performance as a complex military and government contractor in federal projects. And so we have done design build from anything from on the base, a building on a base, all the way to biocontainment units. And then now we've got these mobile triage units that I mentioned that we're going to talk about a little bit today. But jumping into kind of our why and how we got to this point with this project, I want to share with you on that. And if you can go to that PowerPoint, Sarah, or I can get it from here. And this is what we wanted to start with, is when it became a COVID-19 pandemic world, our leaders, our executive vice president, Cliff Hokinson, and his innovative team started thinking about what can we do to help with COVID-19 and to help with anything to be able to solve this pandemic type issue. We felt compelled that our experience as a government contractor, as someone who's done biocontainment, could really help in this stage or in this platform in building the mobile triage unit. Now, as you see here in our top screen, this is one of our first things we did years ago, and it's a containerized biocontainment system, or the CBCS, which actually is a flyable unit. As you can see, it's being loaded on the 747 transport plane. And we were able to develop this unit as a single, they're basically shipping containers, but they're highly modified, obviously, right? But we developed it, made it airworthy to be able to fly, and we actually were able to bring home some infected patients from Japan, and that had to do with COVID-19. Even before that, we had developed containerized biocontainment units like this for even the Ebola virus that had hit the world years ago, as far as that goes. So our why behind that was this. we really had connections where people were being affected in our own lives, and we needed to do something for COVID. And then we wanted to just really help out with the community, with the country, and how that was affecting us. So the timeline brought us to January, February, where COVID became a global threat. And like I said, we'd already fabricated, we'd built, we'd used our CBCS, and that brought patients back. Well, Cliff and his team and our owners of the company started thinking and really had some inspiration. Hey, we can build something. We weld, we put together metal and steel fabrication of parts. And that's what we can do to help with COVID-19. Can't do masks, we can't do any other PPE, but we started to talk about the concept of the mobile triage unit. And that was around in March when we started getting that initial concept. And Cliff and his team went to work to try and get this started. And by the time April came around, we already had the production of the first mobile triage unit going into our shop and being able to be built. Going back a little bit, of course, when he was thinking about this inspiration, we thought about this problem, and everybody knew the problem in the world mostly and familiar with it, but we wanted to build something, a mobile triage unit or some kind of containerized unit where we can separate the patients and other infected COVID-19, patients or medical staff and so forth. We were worried about cross-contamination as we thought about this. We didn't want areas where the HVAC system or the airflow wasn't good enough to keep these patients separated, or even our doctors and our nurses separate. And so we also thought about temporary places. Are those really going to be effective in what they can do and what they can help with? And then as we went along this timeline, and we're at the same time, the shop is starting to build a concept and idea already, we're finding out more and more by talking to hospitals, to states, the federal level. Hey, we have small and rural hospitals that don't have the size or the capacity to house someone that gets COVID. You get one patient in one of our, say, Utah rural hospitals that only has, less than 50 beds, you could infect and shut down the hospital. And when they're going to send them to Salt Lake City or Philadelphia or somewhere bigger, Miami, maybe they don't have the room for them. So we really thought, hey, our unit can help with these small rural type hospitals and be able to work in that situation. Now, this is just one example, like I mentioned, where, hey, things were set up quickly. The country did what we could do with what we already had. This is in New York, but this is only one case. Utah, in Salt Lake, we had a convention center that was set up similar to this. And everybody believed, okay, it's got large capacity. We can house people, patients that are infected or not. It's already constructed, and you can get a quick turnaround. Something can happen and be done going forward quickly. As we looked at that, and we're slowly developing and building it at the same time, design, build the mobile triage unit, we figured we've got to take care of some of these things. Each room was open, so we needed enclosed space. We needed a HVAC system that could really be designed and help for medical purposes. These kind of places didn't have a HEPA filtration. There was slower air circulation, and there was a higher potential for spreading the infectious disease at that time. And also no power for medical equipment that we may need right there at that time. The wall panels were not really designed for decontamination. There's no doors that are really separating. It was just a cloth type separation. And so as it developed through April, we're still building the unit. And within a 9-week period after the concept, by May, we had this mobile triage unit built. And that mobile triage unit is basically what we talked about is really 7 containers that are highly modified in that. We got to May of 2020 and started thinking, okay, we've got this unit. We're going to start getting some people to come through and try and exhibit the unit, try and market it even more than we had going at the time. And our solution included a few of these things with the mobile triage unit. It allowed us to sort and occurs and getting potential critical patients, out of the elements more than what we just saw in just like a convention center. And we can control the environment a little bit more with the mobile triage unit. The unit, in a sense, has 4 patient wings. They provided isolation with the airflow. You can have a different type of patient in each separate wing, so you don't get cross-contamination. And again, you have single airflow going through the units, so we keep the doctors in there and the nurses from being contaminated also. And then it was a long-term solution, like we talked about, for hospitals without capacity of an infectious disease area or one that they can set up on their own and go through there. So the purposes are some that we've already touched on. We're combating COVID-19, any other infectious diseases like Ebola and so forth that we talked about. It can be an emergency response, even for hurricanes. The one into Miami, we were hurricane tested on that one, and it's there for any hurricane need or disasters that way. Already established buildings, that provides another 11 to 12 beds. And it allows for remote healthcare in rural and hard to access areas. This whole unit has its own heating, cooling, water, of course, restrooms. So it can go for 7 to 10 days on its own without needing any type of backup or supplies as far as that goes. And that leads us back to where we were, getting people to come through it, and we exhibited it. At this point, Cliff and his team were saying, hey, let's help out even more. This first prototype unit, let's try and get that to somewhere in need that really needs it. Say a city or a hospital or Navajo Nation. We went after everybody and got donation statements from them. And this unit ended up being a sort of a partial donation because everybody had to invest in it, obviously. But it finally got to a point where we had it ready to go and be able to ship it to an area. So we took in statements, and that's where I bring in Dr. Epstein with his son that's not with us today, Dr. Aaron Epstein. They gave us a need that they had with their global surgical and medical support group and with Jackson Hospital. And that really led us to being able to deliver this project to them and be able to use it in an area of great needs as far as that goes. So Dr. Epstein, I know we haven't had a lot of time to talk through what to talk about, but it's kind of here. Maybe talk about your group that you and Aaron have going with GSMSG, and then kind of how it evolved from there, how you came out, looked at our unit, and we were able to deliver it to Miami, and we'll fill in from there as we need. So,
okay. Can you hear me okay?
Yeah, we can hear you good.
Oh, okay. So I have to make really clear right up the front that this organization is my son Aaron's creation, and he's the brainchild. And I came in well after it was fully established, and I am a board member and an actively participating physician. But this was my son Aaron's creation right from the beginning, and I did not have anything to do with the inception. So I have to give full credit to him for that. This very briefly about the organization. He started in 2015 as a response to the ISIS calamity that was created in Iraq. With over 1 million refugees and internally displaced people. He had connections with both the civilian foreign service and military intelligence. People he knew, and they were kind of saying that it would be kind of useful if something could be done to help out there. So he started on his own, making a trip there. And then subsequently, it really kind of snowballed to a point where since 2015, now he has around 1,200 active volunteers, 400 physicians, including 400 physicians. The rest are nurses, medics, paramedics, with a very heavy participation by military, ex-military, medical providers. Mostly still our focus is in northern Iraq. The initial efforts for really direct patient care. We came in with trauma surgeons, orthopedic surgeons, and most of our initial staffing and the support staff. And then as the actual combat lines moved from what were originally 15 to 20 miles to our west, that was the area between Erbil in the Kurdish region and Mosul, which is fully occupied by ISIS, as the coalition forces and the Peshmerga pushed the ISIS battlefront further west, our role kind of morphed from direct patient care, because a lot of the actual victims were being treated in the field by some other entities, to local capacity building. And that's really what we've been doing a lot of since then, as well as subsequent, we've had teams now in West Africa, starting in South America. We've done training in Europe. So it's really been growing kind of fairly steady basis. Now, as far as our cooperation or collaboration with HHI, the way I understand, I was not the one involved in the actual invitations and discussions. So my version from Aaron is that he had GSMSG teams working in New York City, helping out, pretty much volunteering alongside other entities and institutions. And I guess the call or invitation for this brand new MTU concept, or as it was put together in this version, came out about the time the epidemic, the first wave. I got to be careful how I use terminology here. The first wave of the epidemic in New York City was already winding down, and that was about the time it was really starting to wind up in South Florida. And through his connections that Aaron had at University of Miami, actually really Jackson Health System, who was the major clinical provider for facility for the University of Miami, they seem to be very interested in it for any of a number of reasons, most of which Ralph has already touched on. They were looking at a very rapidly increasing COVID problem, but also they were walking right into hurricane season. And the idea of having an attachment to a hospital that was, let's just say, hurricane-proof for practical purposes, certainly was better than what we were seeing at other hospitals in Florida that I'm aware of, where you would see that ubiquitous tent. But a tent, even a heavily constructed tent, is not going to hold up to a Category 3 hurricane or more, maybe not even Category 2. So it was that connection of nexus of events and availability, and Aaron had the discussions with Cliff and maybe you, and that was, I guess, how the arrangement with the donation to GSMSG and then the transfer to Jackson took place. And I had the good fortune of, I guess, Aaron's a surgical resident in the University at Buffalo, and he's very busy. So fortunately, he was tied up when it came time, I guess, for the original showing of the completed 7-unit MTU in Ogden. And so I got to go for him, which was a great pleasure. And so I was able to go to Utah and enjoy the scenery and the hospitality of HHI. And then subsequent to that, if I understand correctly, there was a lot of cooperation between Jackson's team and HHI, where a lot of modifications were made to the original design. And next, in September, it shows up. So that's kind of my brief story. I don't know if I missed anything. Please fill it in for me. No,
that was great. I appreciate that. And what happened was, like you said, is the first MTU was being developed, like I said, along that timeline. And like Dr. Epstein was saying, is they came out and actually walked through that one and got a great feel. We were able to deliver our second built MTU because GSMSG and Axel Jackson Health System was looking for a little bit more permanent application, which it's turned out to be. And so we built into their specifications down there at Jackson Hospital, which really gave us a great opportunity to collaborate with not only David's and Aaron's group, their GSMSG group, but we had Jackson Hospital president, and we had a lot of their facilities people be able to come up and give us great collaboration on this is what we need in our second unit. And so we went through along the timeline and actually built that second unit for them. The unit actually was able to be built and shipped to them in August, August month, and then September was the open house. And that second unit was been placed there and is here in this picture in a permanent site now by their helipad. And they're able to use it and have access to it. And then, like Dr. Epstein said, is if their group needs it somewhere, this is mobile capability still, even though it's in a permanent location for a minute here. It can be moved to wherever the disaster is that GSMSG group can take it, be able to use it, like I said, be self-sustaining as far as that goes. So we got it developed down there. It was a great collaboration, like I mentioned, as far as that goes. And that was pretty much the project development. We've been able to now learn from the mobile triage unit that we can build single containers like these for portable testing of COVID-19, or just a separate little triage unit that would hold a couple of patients for just one container. So with this project collaboration and project development delivery, we're able to get this now to cruise lines, get it to just testing facilities as far as around the country for our other portable test labs. So that's it. I appreciate everybody being there. Do we have any questions that we need to get to or comments? Let's take a look and see if we go back to our other slide here. Nothing further on the comments that I can see. Anything else, Dr. Epstein, you want to add about the mobile triage unit, the project delivery, or what you foresee in the future that maybe these can be in different areas for your group?
Well, I'm projecting a good bit beyond our current footprint, but what we've seen with these very functional units in live. As we go forward, we are hoping to have greater collaboration with other entities, specifically the Department of Defense, if we are able to do some joint deployments in outside the United States, obviously, maybe in South America or Africa, where our deployments are not as episodic as we currently are. That we could very easily see something like being very usable, particularly if one were a downscaled version. I think we wouldn't probably try to move something of this size, but something maybe a 1 or 2 unit version, maybe one that was also equipped as an OR. It would very easily, these types of functionality built in, could be easily made into a clinic/OR on a smaller footprint. So that's kind of what we would really like to be doing as an organization and with that capability. We're not quite there yet, but that's kind of from looking down the road. Yeah, that's a valid point. Like you'd mentioned, and I just said, we have kind of spun this off in another collaboration, another project development in those portable test labs where it's just one single container and move those to different entities. So that'll be something that we're following up on as far as that goes.
We did get a question about if we have interior images. We can work on doing that. If not during this live presentation, if you go to our booth, HHI Corporation, I do have live or images up in there on our reports that we've had as far as that goes, and go from there as far as seeing the interiors of it. But everything on the interior of it has been built hospital grade, easy to clean, very smooth and clean as far as for a hospital containment, or just like you would in a hospital wing as far as that goes on that. So I don't see anything else. So I appreciate everybody being here at the conference. Thanks, Dr. Epstein, for coming in here and filling in for us and helping us out. Appreciate your work.
My pleasure.
Thank you. Take care, everyone.